Jim?
Hello, Dr. Todorova. My name is Bryan Haas. I'm here with my son. Do you give us permission to go ahead and videotape the neuro exam and upload it to YouTube?
Yes.
Awesome. Thank you so much. And then what we do is we first start off, of course, we'd wash our hands before we came into the room. As we come into the room, we were trying to assess his level of consciousness. We're looking to see, does eyes open spontaneously? Does he follow commands, yes or no? Is he alert? And what's his orientation? If he's orientated times 4 with those other components, he would be on a Glasgow Coma scale, a score of 15, which is awesome. So assessing his orientation, we're going to ask him a few questions. The first is, what's your name?
Jaden.
Where are you at?
My house.
What day is it?
Saturday.
And why are you here?
I'm helping my dad with his exam.
Good. So he's orientated times 4, and that's awesome. Person, place, time, situation, or event. The next part, and as he's talking, we want to assess his speech. What's his speech like? Is it pronounced? Is he vocal with his speech? The pitch of it, the speed of it. Is he slurring his words? Is he have difficulty remembering his words, etc.? He's got a normal speech pattern, which is awesome. The next part of this exam is we want to assess his memory. Let's do short-term memory, recent memory. Let's ask him a question like, what'd you have for breakfast?
Cereal.
Awesome. And then, so remote memory is a distant memory. The most distant memory you can remember. What would that be?
I remember I used to hide in our dryer in the other room.
Right.
Which was like a hiding spot.
How old were you?
I'm like 5.
Awesome. I can attest to that because I remember that. The next part is just testing his reasonability to a situation or event, let's say. Let's say you're walking down the sidewalk and you see an envelope on the sidewalk and it's got a stamp on it and it's got a to and from names and addresses to and from. What would you do with that envelope?
Put it in the mailbox.
That's a reasonable answer. That seems like something that I would do as well, so that's good. The next part of the exam is we're going to assess his cranial nerves. I want you to close your eyes there. The first cranial nerve is the olfactory. We're going to close off one nostril and see if you can smell this.
Pepper.
Good. And we're going to close off the other nostril, see if you can smell this.
Cinnamon.
Good. So that's olfactory. The next nerve is cranial nerve number 2. That's the optic nerve. I want to apologize, Dr. Todorova. I forgot my Snellen eye chart at the office. I was doing physical exams on the athletes from the high school, football and cheerleading athletes there. But if I had the Snellen eye chart, I'd hold it. I have a pocket one. I'd hold it 6 feet away. I'd have the patient close off their right eye, and I'd have them read the most bottom line that they could read. And as they could read that, I'd make note what the vision was it 2020, 2040, 2015. I'd switch eyes 6 feet away with the same Snellen eye chart, same thing, read that, mark and note what the vision was there. And then lastly, Snellen eye chart 6 feet away with both eyes, mark and make note of the vision there. If I was in the office, it would be 20 feet away, measuring the vision there with the optic nerve. The next part is is the visual fields of confrontation. So we're assessing his peripheral vision. Go ahead and cover your right eye. I cover my left eye. I'm going to have you let me know when I wiggle my fingers here in these different. Say yes or
Yes. 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 Yes.
Good. Cover the other eye. He's covering his left. I'd cover my right. So let's do that again.
Yes. 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 Yes.
Good. Now we assess both eyes here. Tell me if it's right or left here. Which one's wiggled?
Right. Left. Left. Right.
Good. Now let's do it again.
Left. Right.
Good. And then, so that's testing all of the peripheral vision there. And then next part of the exams, we want to use the ophthalmoscope. We're checking, this is the fundoscopic exam. The lights would be dimmed in this part of the exam there. As I turn this on, I would use my right eye to his right eye, stabilizing his head with my opposite hand here. 2 fingers holding it and 3 fingers stabilizing it for protection to make sure this is not jammed into his eye there. Using my right eye to look into that, we're trying to look at the cardinal fields. I'm sorry, we're looking at the red reflex, looking and seeing the red reflex, the blood vessels there for any AV nicking, cotton wool spots. We trace that over to see what the disc and the cup looks like and see what that ratio is. It should be less 1:3 to 1/2 there. And then we do the other side, we stabilize with the right, and using my left eye, we're following that in, using 3 hands or 3 fingers for protection or safety. Follow that in with my left eye, red reflex, same thing. Any AV nicking, cotton wool spots, trace that over at the disc and the cup, and that ratio, marking down that ratio, again 1/3 to 1/2 there. The other part of the exam is we want to look and see his pupils. We want to see if they react direct and consensual light reflex there. So I'm going to shine this into his pupil there. That should constrict on the same side, and then I shine it there, and that should constrict on the opposite side there, and that's consensual light reflex. And if I follow that over direct on this side there, looking at the pupil constrict, and then go over there and looking to see if the opposite one constricts, and that does there. The next part of the exam is looking at cranial nerves 3, 4, and 6. 3 is ocular motor, looking at 4 is trochlear, and then 6 is abducens. So these are the cardinal fields of gaze there. Cranial nerve 3, pretty much looking at all the external ocular movements except for medial, lateral, and down. The trochlear nerve assesses and evaluates the ocular movements both medial and down. And then the abducens nerve is assessing the ocular movements lateral there. So we want to assess and look at the cardinal fields of gaze, have the patient follow the tip of this marker here. We want to see if there's any nystagmus, how he's following any pursuits. We're looking to see how his eyes are pursuing and looking for any involuntary movements called nystagmus there. And that's good there. Awesome. Next part of the exam is the trigeminal nerve. The trigeminal nerve has 3 branches. So a branch goes up to his forehead, to his cheek, and then his jaw there. We want to assess all 3. We have a cotton tip, Q-tip here, so we have dull and sharp. You tell me where it's dull and sharp as I touch your forehead here. On both sides we're doing this.
Dull, sharp, 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 dull, sharp, dull, sharp, dull. Good. So we checked all 3 levels there. Next thing is going to open up your jaw there. Okay, that's good there. So we checked 3, 4, and 6. We checked the trigeminal nerve here. The next is cranial nerve number 7, which is the facial nerve. With the facial nerve, we're going to have him frown or squint his forehead there. Raise your eyebrows there. Good. Then go ahead and smile. So the facial nerves have the upper and lower division there, and then go ahead and puff out your cheeks. So obviously we frowned his forehead, that's the upper division, then we just assessed the lower division there. The next cranial nerve we want to check is the vestibular cochlear, and that is, we're going to do a whisper test. So we're going to close off one ear on this side, come behind him a couple feet. We're going to say a couple words. This is the whisper test. High school. Go ahead and repeat that. High school.
Good. And we're going to close off this one here.
Football.
Right. So we had 2 syllable words, high school and then football. He got that there, of course. And then the next part of the vestibular cochlear test, cranial nerve, is we're testing the Weber's test. So we're going to strike the tuning fork, place it in the forehead there. Do you hear the sound equally on both ears?
Mm-hmm.
Good. And that's normal. If it lateralizes to one ear, he could have a sensory neuro loss on that one side there. The next part of this exam is Renee's test. I call it Renee's. Some people say Ryan's. What we do is we strike it again, put it on the mastoid process,
Wait until he can't hear that anymore. Tell me when you can't hear that. Can you hear it still?
Oh, yeah.
Okay, so now we can hear air conduction was greater than bone conduction. That's normal. And then we repeat this on the opposite side, do it on both sides. Air conduction should be greater than bone conduction there. That's Renee's test there. Okay, the next part of the exam is we're going to assess the glossopharyngeal and the vagus nerves. So what we're going to do is we're going to have them open up your mouth. Open up your mouth. We're looking at, when we ask the patient to say ah. We're seeing the uvula rise there, and then go ahead and swallow there. Let's see you swallow. Swallow. Go ahead and swallow.
I can't swallow with mine.
Okay, go ahead and swallow. Open up again. Good. So that's the glossopharyngeal and the vagus nerve there. And then, okay, very good there. And then the next part, or the next cranial nerve there, is the the accessory nerve, which is 11. So we did 9, 10, vagus is 10, and then the accessory nerve is testing his trap muscles there. Go ahead and elevate your traps there. Good, and we also want to check the SCMs on the right side here. Go ahead and go against resistance there, against resistance there. It's testing the SCMs on both sides. That's the accessory nerve. The last one's the hypoglossal. Go ahead and stick your tongue out there. Good. Now, so we want to see if it's midline there. With the glossopharyngeal, the uvula should raise, and it should raise midline there, and the tongue should come out centrally there, and it does. Okay. Put your tongue into this cheek here. Good. Tongue into this cheek there. Awesome. So we're finished with the hypoglossal there. That concludes the cranial nerves. Then let's go into, and we're going to assess the cerebellum later on, because I have to hold the camera there, and we'll follow that. The next part of the exam is we're going to assess position sense. So if I take your finger, close your eyes there. Close your eyes. I'm going to take your finger. You tell me if I'm bending it, or if I'm pushing it down or up. Okay?
Mm-hmm.
So
down, up, down.
Good. Let's do this one.
Up, down, up.
Okay, and then we'll do also, we're going to assess his toes there. Close your eyes. Let's do it with your toes. Is it going down or up?
Down, up.
Good. The other one?
Down, up.
Good. So that's position sense there. The next one is we're going to do 2-point discrimination there. Close your eyes. When I touch you, you got to tell me if there's 1 point or 2 points when I touch you. You got it?
Mm-hmm.
Okay, so we'll do upper extremity here. Let's go here.
2 points.
Good.
2 points.
That's 1.
Oh. That's 2 points.
Good. And let's do that again.
1 point.
Good. And let's test this side.
2 points. 1 point. 2 points.
Good. Let's do the lower extremity.
2 points. 1 point. 2 points.
Good.
2 points. 1 point. 2 points. 1 point.
Good. So that was good there. Next one is the stereognosis. We're going to close your eyes.
Mm-hmm.
We're going to put something in his hands. You've got to see if you can recognize this object there.
Coin.
Good. There's a coin there. Awesome. The next part of the exam is we're going to assess his upper and lower, so the cutaneous sensation we want to see, and want to see if he can also identify any painful stimulation. So we have the cutaneous, the surface of the superficial cutaneous stimulation, superficial painful stimulation there. So I have a tissue, and I have a paperclip. You tell me if it's tissue or paperclip. Close your eyes there.
Tissue. Paperclip. Tissue. Paperclip. Tissue. Paperclip.
Good.
tissue,
Lower extremity.
paperclip, tissue, paperclip, paperclip, tissue, tissue.
Awesome. So we got that there. Excellent. Okay. The next part of the exam is we're going to that finishes the sensory. Now we want to do the motor part there. So we're going to check his motor strength there. Put your arms up like this here. We're checking the deltoids. Hold strong there. Good. Put your arms up like this. We're testing the triceps, biceps. Good. And then we want to check the, I don't know if you can see here, bring your up leg, go ahead and kick forward for me. That's his quad, pull back there. That's his hamstring there. Do this one. Kick up, that's his quad, pull back, that's his hamstring. Then we want to test the abductors and abductors of his hip. Go ahead and push close there. That's his adductors, and then external rotation of the hip is the abductors there. That's really good there. So we got really good strength. It should be 5+, and his are all 5+ there. The next part of the exam is we want to check and see. We want to check the strength of his fingers. We want to see what's his grip strength. Let's do grip strength. Go ahead and squeeze my hands there. Ow. Okay. He's pretty strong. He's squeezing pretty tight there. All right. Close your fingers off. Go like this. Okay. Don't let me open up your fingers there. We're testing his finger strength there. Those are all good. Okay. Awesome. Now open up your fingers. Now I'm going to try to pinch them together there. I'm going to try to pinch them together. Pinch them together. Good. He's got really strong fingers. He works out quite a bit there. He almost crushed my my hands there with his grip strength there. Pretty strong kid. Okay, the next part of the exam is we're checking reflexes. So if we test his reflexes, if we can test his biceps reflex there. So we're going to hold this here, and if we press into the biceps, hold the tendon there and just strike it. Strike it. There's a nice little twitch there. That's the biceps. We hold the triceps there. Let your arm just dangle there. We're going to strike the triceps. Good. Awesome. This side here, biceps here. We're going to come into the biceps and just strike that. Good. Triceps there. Hold that. Good. And then we're going to use the patella here. I don't know if you can see this. The patella. We're striking the patella on the right side. That was a nice kick. Left side there. And then we come on down. Let's see here. Maybe you can put your leg up here, Jaden. And we want to test the Achilles there. We're striking the Achilles there to see if we get a nice little plantar flex, and we do. Good. The other one. We're checking the Achilles there. Good. Let's put this one up. Now we're checking the Babinski reflex. We're going to use the reflex hammer and strike the we're going to scrape the bottom of his feet, and his toes should curl, and then they do. That's a normal response. In infants less than a year old, they'll flare up. Do this one here. Okay. Good. Go like that, and that comes down there like that. Awesome. Let's now test do some cerebellar tests there. Let's have him see what kind of coordination this young man has. I want you to go like that as fast as you can. Good. That's good. He's testing his coordination for cerebellum, the back part of his brain. It controls his balance and coordination. Now I want you, this finger here, touch your nose and then touch my finger. But once you touch your nose, you can reach and look at my finger and touch it. Good. Different areas here. Good. Other one. Good. And then one more here. Awesome. So we got that. Okay. The next part of the exam is we did all that. We did the reflexes. We want to continue with the cerebellar exam. We have to turn the light on there. Actually, we can do it right here. We're going to have him walk. We're going to see him actually, let's have him stand first. We're going to stand, and we're going to test to see what is his see if he has any pronator drift to his, as he stands there. Close your eyes there. Mm-hmm. Good. As he stands there, his hand should not go into pronation. If I slap him down like that, they should come back up to normal there. So that's normal. The next part of the exam is we're going to have him walk, and we're going to check his gait. As we check his gait, let me do that. Let's have him walk there. Let's see here. Jaden, you're going to walk across the kitchen there. And we're checking his gait to see. Go ahead and walk forward. And walk backwards. Turn around.
Backwards?
No. Okay, come towards me again. We're checking his, face me. We're just checking his gait to see. Okay, good. And backwards there. We're checking to see his balance, to see he's got balance there. He's coordinated there. Do a tandem walk for you to go heel, toe. Yep, like that. He's got good balance there. Good. And then what we're going to do is walk on your heels. Go back, go forward and walk on your heels. Heels.
Oh, heels.
Walk on your heels. And then walk on your toes. Go forward on your toes. Okay. Good. And then I think, let's see, that is it. That concludes the exam. Thank you so much for Dr. Todorova.